after people retire, does the corporations, how long do they pay for people's medical?
Now?
Yeah.
Or now?
Whenever.
In the current system, people qualify for Medicare at the age of 65. Medicare is a right. At the age of 65, you are enrolled in Medicare Part A, which pays for all hospital care and costs you nothing. You may, if you wish, enroll in Medicare Part B, which pays for doctor visits and so forth and so on, costs you $96.40 a month. That $96.40 a month is 1/4 of the amount that it actually costs. So you, the taxpayer, are paying 3/4 of the cost of the right for seniors to have guaranteed health care after the age of 65. Now, a person who has employed as in a company for 20 years will also have, in some instances, unless their company has gone bankrupt or cut out their plan or something like that, a person who's employed will have often another policy, a health insurance policy that is the retiree's policy, for which they pay nothing or little. That policy is the primary payer for their medical insurance. Medicare then becomes the secondary payer. And sometimes they'll buy the Part B, sometimes they won't. But it is a right of everyone over 65 to have free hospital care.
Is there a coalition of...
Yes and no. A few years back, that's a very difficult political question. Right now there is a fracture. There is a fracture in the coalition that was supporting the idea that everybody should be required to buy insurance through a private insurance company. And the fracture involves exactly that. Larger businesses are saying, why in the hell should we pay that extra 31% to the insurance companies? We don't want to have to force people to buy insurance. We'd like to get rid of this problem altogether. And so there is a fracture. It's kind of sub rosa. It's not right out in the open, but it developed right around December. And so politically, this is the time to strike. Yes?
Have you ever looked into the Canadian system?
Yes, I live in Canada in the summertime. I've had health care there every year, or my kids have had health care every year. It's excellent. When we first started going there, my son has seizures, and he had a seizure. We went to the emergency room. He got all kinds of blood tests. He got a CT scan, blah, 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 blah. They were there for many hours. There was an ambulance ride, et cetera, et cetera, et cetera. We got charged $300. Now, when you go, the province is wised up because there are a lot of Americans there in the summertime. And so now, whenever you go to the provincial hospital and go to the emergency room, they charge you $500, no matter what it is. So if I were to go there with a broken leg and have to have surgery and stuff, it would cost me $500. If I were to go there with a sprained finger and have to have a Band-Aid, it would cost me $500. They have one billing clerk in that hospital, one part-time billing clerk. Her only job is to fill out a little form that says, oh, thanks, we took your Visa card and it cost you $500. That's what Canadian healthcare is. Canadians love it. Guess what? There are no Canadians that worry about losing their job. Why? Because they don't have to worry about healthcare. Yeah, I gotta go. Last one. Go ahead.
Okay. I know that that's true because my husband and I spent time in the emergency room just last year. But I also know from all my friends and my living in Canada that people don't even pay $200 for 3 months of insurance, and they have good health care, and they don't lose their house.
Right.
And they don't lose their...
There is no financial barrier to health care in Canada. None. Zero. I had a friend who was in the hospital for 3 days, had every test known to God and man. He got out of the hospital. He was pissed off. I said, Red, why are you mad? He said, geez, that cost me $200. I said, he was mad. I said, why are you mad, Red? He said, I got a bill. I said, why'd you get a bill? He said, it cost me $200. I had a single room. Tough in Canada. Thank you.